talked to you that first time, it was almost like you were miserable just in life because you had so many troubles, so much trouble with your knee that you couldn't walk on a daily basis. Just everything was a struggle for you because of that. But then on top of that, you've seen doctor after doctor that you were basically like, let's try the holistic approach. It's my only thing left to do. So what'd you do to let me see you like you are now?
So in the last 10 years or so, I've seen probably every specialty. I've seen an endocrinologist, an orthopedic, your PCP, 4 different ER doctors, and none of them could figure out what's going on with my knees. It would swell like the size of a softball. I took medication upon medication, no idea, no way to figure it out. And then one day we decided to try the holistic approach. We saw Dr. Haque, and when I saw Dr. Haque, he said, I know what this issue is, it's your diet. And I'd asked every doctor before that, is this my diet? Could it be my diet? No, there's no way. Diet doesn't work that way. And the first thing he said, well, what do you eat? You eat a lot of processed food? Yes. You eat a lot of sugar?
Yes.
Yes. Okay, well, those are highly inflammatory. That's part of your issue right there. So he moved me to a plant-based diet, fully plant-based diet, and when I embraced that, it was within the first week, I could walk. And I haven't had a single issue for going on 2 months now. And that was impossible. If I was getting 3 to 4 days in a month walking with pain, I was doing good at that point. And at this point now, I'm at the point now I'm ready to start trying to build muscle and work out again and run and get my body in shape again. This is within 2 months of seeing Dr. Haque. So we're talking about somebody with a PhD from Harvard in nutrition compared to somebody who does essentially 2 months, 3 months in school talking about nutrition, and they want to give you pills to cover up your issue instead of dealing with the problem.
But not only your knee issue, you were telling me just a little bit ago that you by just changing your diet, you were able to lose some weight though.
Yeah, so when I first came in here 2 months ago to Dr. Haque's office, I was almost 240 pounds. I'm now at 188, and that's just simple dietary changes.
What about your mood and everything?
Mood is excellent. Mood is excellent. I feel very good. Mental clarity is heightened. I sleep minimum about 8 hours a day now. Before it was about 6. Job informed has gone way up. I'm a leader at my job, so whenever I'm in charge, I got to have mental clarity. It works extremely well. I feel a lot better. I'm awake a lot more. I feel a lot better, obviously. I don't have any crash during the middle of the day, which is excellent. I really can't say enough about the plant-based diet.
All right, Dr. Haque, what did you tell him to do? Suggest for him to do? What'd you tell him for? Like, I can't believe the Chase I'm seeing 2 months later.
Actually, every disease has a root cause, right? When someone is sick, what my functional medicine practice, what I do, I dig down the root cause, where the disease is coming from. So he came to us in our clinic that he couldn't walk, knee issue, and doctors has been giving. I've been seeing. I went through his prescriptions. Doctor was giving him painkiller, this and that, focusing on the locally in here, on the knees. And I looked, deeply that kidney dysfunction making that issue, because kidney was not filtering his toxins and toxin could develop anywhere. And that toxin developed in his knee, So what I did, the food is going to be toxic to him, especially for his kidney. I said, don't take that food, and then kidney is going to be functioning better day by day. Not only the food, actually I give him some supplement based on his symptom, based on his overall body condition. So I supported his kidney, I supported his digestion, take off the food he's eating not right for him, as well as emotion. I give him some good guidelines how to get rid of the emotion, feeling him better, good sleep, and emotionally sound. Also, I gave him specifically to lose some weight. Losing some weight, he was 200 something, now he lost 30, almost, how much pound?
Almost 40.
Almost 40. So in a month, he lost almost 40 pounds. That's 40 pounds, he didn't lose muscle, he lost the excess fat.
Mm-hmm.
So every single fat cell is a toxin. Because when he eats wrong food, body could not process this out. Body, instead of hurting the body, what body does, body neurology system is body, wrap it up with as a fat cell, so it doesn't hurt his body. So what we did, instead of focusing on his only medicine, what we did, stop the wrong food, get the detox, so excessive toxin fat cell come out of his body.
So a combination of supplements, changing his diet, and then you gave him some advice about to help mentally and stuff. So all that combination.
Combinations, yes, that's called holistic approach, yeah.
And then we get this from Chase.
And not only Chase, for everyone.
Why not? Yeah.
Everyone comes to our clinic, we do focus on what causing his problem, cut off the root causes, and then you see the miracle. You have seen the other patients, how the patient yesterday came to us saying that my baby got released from the hospital. I said, what happened? And the baby 10 days ago, they consulted with us. What happened? Baby was stage 4 brain tumor cancer, and baby could not could not release from the hospital, and within 10 days, baby's platelets going high and normal, blood count is good, he's functioning well, and he got released from the hospital. So look at the root cause of any disease. Otherwise, keep taking medicine, and one medicine is going to produce multiple disease, and you will be ending your life in a hospital with a load of all the disease, and as if like you didn't exist in the world, as if you came in the world to be failed. You know what I mean?
Yeah, I couldn't agree more with that. Yeah, Dr. Haque has done a phenomenal job. I saw, like I said, 10 years of specialist, no clue. 2 months of him being essentially on PCP. I see him every 2 weeks, essentially a PCP, and massive difference.
I'm in shock from the first time I saw you until now.
When I first came in here, I was on crutches, and that was like my permanent state at that point, pretty much, was being on crutches.
Actually, all credit goes to him. You know what?
Well, yes.
Because he maintained it. He was dedicated to start, and he did start. He followed the guideline, lifestyle modifications, and he maintained the supplement, natural medicine I gave it to him, and all the guidelines that I gave to him. He trusted. He worked on it.
Trusted you and took your guidance, and you
like
had the willingness and the determination.
Absolutely,
yeah.
Absolutely. And the thing I would say, if people were nervous about this approach, this is not an approach of we're going to give you some pills and see what happens. This is a scientifically based, evidence-based medicine approach. It's not. We're not going to treat a condition. Or treat a symptom. We're going to treat a condition, and that's really what you want from your medicine. And if you follow the dietary guidelines and you don't put essentially poisonous stuff in your body will heal itself. It's wild.
Exactly.
Yeah.
Thank you, Chase.
No problem.
All the good job. Thank you.
Absolutely.
Thank you, Chase. Thank you, Dr. Haque.
Yeah.